I'm here to share the journey of a young idealist working in government, trying to develop a better health system. So, this isn't the life that I pictured for myself when I was being asked growing up, what do I want to be in the future? I just said that I wanted to be the bestest, the brightest, the most useful person that I could be. And what's the embodiment of that than being a doctor, right? Like the doctor heals, cares, literally saves lives. And the young me just said, okay, I wanted to do that. I want to be a doctor. But what I didn't realize that what I was really looking for was meaning, having an impact, or trying to understand what I could do for other people. And the more life events that I went through, the more people I started to interact with, the more frustrated I was in trying to find that meaning. Like, what is the meaning of me and my family living a very comfortable life when just across our street would be slums of people struggling, just trying to make a basic living? What's the meaning of me being part of very prestigious universities and being around the best minds in the country when it is actually those institutions that have perpetuated the inequities in our country to begin with? What was the meaning of being able to know the latest treatments, the latest procedures, the most advanced technologies, when doing that to patients would put them in medical debt and they would just go home to their families, to the situations that made them sick in the first place? I was so frustrated. And I had this guilt in the privilege that I was given, that my being had to be something more and bigger than just myself. And I guess the way that I found my meaning is trying to use my privilege and my being an agent to remove all of these structural barriers for all of the people that I've met. And where else could I do that but working in government? I mean, where else would you have the official mandate to make a difference? Where else would you have the opportunity to influence the thoughts, the outputs that actually change your country's trajectory to progress? Like, where else would my ideas, skills, and times be needed more? And where else would your impact would be more than just one person or group, but for a whole country? And of course, you can do this elsewhere. You can have that impact elsewhere. But I just realized that in all of our desires for change, the government is always our desired stakeholder in trying to push for that change. And when I realized this reality, I was hooked. I knew there was no better place for me to be in and for me to put my skills in than to work for government. But working in government is usually not a popular choice. It has a lot of bad reputations in my context, and I'm sure in a lot of contexts as well. It's inefficient, bureaucratic processes, corruption, unequal representation, non-ideal things that governments are known to do. And these are things that I also experienced working from within. But in my relatively short stay in working in government, I usually have 3 guiding things to push for meaning in myself and in what I do in these uncertain times. The first thing I realized is, if I really wanted change, the focus should not be on just getting a best leader to create this, but on creating a very agile bureaucracy. There used to be a very messianic view of the leader in government. And I think that also helps perpetuate the helplessness and the passiveness that people in bureaucracy feel. It's because the leadership just shifts, and that's a reality in government. And I think I realized that if you really wanted change, you have to shape, strengthen, and capacitate the core workforce and the mechanisms that are within. And that is how you make sustainable change that will last even across political milieu. And I think the learnings on distributive leadership was really impactful in me in honing in on that message. And I realized that it's really the necessary tool if we wanted to push for the sustainability of reforms. My second learning is that pushing for equity should not stop at giving the marginalized a seat at the table. Coming from within, I know that it's easy to put that representation and convert that opportunity to tokenism. And it's also easy inside being on an ivory tower. But we should not push for what is easy. It really touched me, our exercise yesterday, and the bodies and space, when we were asked to go on a table and choose where the leader would sit. And then I realized, don't we also do that? When we ask our marginalized representatives to come to the Capitol, to sit at our tables, to come to our conference rooms on our terms, that in itself is disadvantageous for pushing for equity. And the seats will be nothing if we don't have mutually beneficial relationships with the people that we're trying to include. So I believe that the government should actually actively try and adjust and see and hear and experience the issues themselves, not just walking in people's shoes, but actually empathize with the people. And that's hard to do. And there should be people inside government to remind those in power to do that. Usually, for myself, I use the Juan and Juana test. So if this thing is good for Juan and Juana, then it's okay with me. And I think that's just simpler to conceptualize than the framework I wanted to do in the first place. And it's also easier to share as a message to all of the people who just really want to make a difference. And the third realization in pushing for meaning is that the way to move forward is to move together. Health system reforms are overwhelming and are frustrating, but because we've been so used to working in silos. If we share the burden to everyone, then it's going to be easier for everyone. I really like this story of the elephant and the blind men. I don't know if you've heard of it. So these are these blind men trying to describe the elephant in front of them. One is saying it's the trunk, it's the ears, it's the body, it's the legs. All of them were correct, partly correct, but all of them were wrong in insisting that their reality is the true reality. So only by moving together and collaborating and harnessing the diverse skill sets, age groups, experience levels, trainings, all of these are necessary to do these structural changes that we wish to see. The work is too big for a few people alone, and we need to align, of course, not only within government, but to stakeholders outside the government to make sure that all of these are being able to happen. So 2019 has been a very challenging but rewarding year for me working in government. We're very proud to have passed the Universal Healthcare Law, which now gives us mandate to do health system reform, such that in 2040, all Filipinos will have access to the care that they need without experiencing a financial hardship. So that is the dream. And I'm thankful for all of the generations before us that paved the way for this to happen, because we are really standing on the shoulders of giants. So people then who pushed for reform, who pushed on creating an innovative curriculum, mixing MD and MBA, people who took a chance in young kids to be part of policymaking in government. Very thankful for all of these giants. And I feel very lucky that I am part of the group conceptualizing the mechanisms and preparing the country for health system reform now. There's so much to be done in ensuring that equity is done in all angles within our own locus of control. So the meaning of equity and leadership really marked on me this year. I realized that the path to equity is in three forms: distributive leadership, empathy, and collaboration. And persisting, even if it is difficult, even if it hurts, even if it comes at personal expense. And the courage to act and persist in government is what will make the opportunity meaningful. So I welcome everyone, not just here, but also back home, to ride the journey with me as we find meaning in the challenges that we face. To find the value in being frustrated, in feeling inadequate, in doubting our work, especially at this level where it's usually not easy to see meaning because there are usually no tangible outputs. There are no thanks for our hard work, and there's no immediate impact at the policy level. But the value here is that these are manifestations that we care about the work that we do, and that they can become stronger drivers for us to learn and to innovate. So I'm very honored to have had this journey with you this year, to listen to you, to learn from you. This has been really a personally and professionally enriching year. And may we all continue to find meaning in what is around us, in what we do, and in the challenges that we face, until such time that there's no more work to be done and health equity is achieved for all. So, thank you.